Mommy makeovers. Everybody wants to know, what is a mommy makeover? So a mommy makeover is just a generic term that's used to describe doing multiple parts of a woman's body in one setting, one surgical setting. So oftentimes we're going to be working on the breast and the tummy. Those are two areas that are most affected by pregnancy and breastfeeding and childbearing, and also with age. So mommy makeovers typically involve a breast procedure and a tummy procedure. And then you can customize your mommy makeover from there. So it may be a breast augmentation with a tummy tuck. It could be a breast reduction with a tummy tuck. There could be some liposuction thrown in, so it just really is a customizable approach for patients. So the idea of doing making over mommies is really a multiple procedure at one setting. And so patients don't have to have more than one anesthesia, more than one recovery, and we kind of get everything corrected in one setting. So a mommy makeover historically has been breast and abdomen, but we're also adding vaginal rejuvenation or labiaplasty to the procedures because, again, another part of the body that is extremely affected by a pregnancy. So there's non-surgical labiaplasties, there's vaginal tightening that can be done non-surgical, and then there's surgical procedures that can also be done. So with a form of V or a Viva, those are non-surgical treatments. They're done in the comfort of the office. The form of V is for tightening of the internal vaginal tissues, tightening and supporting the pelvic floor. So patients that have a little stress urinary incontinence after having children, that can be a much more effective treatment procedure than Kegels exercises alone. For mommy makeovers, I'm often asked, how much time will it take for me to recover? It takes about 6 weeks for the body to heal. It takes 6 weeks for scars to reach 90% of their ultimate strength. And so during that 6-week time period, I don't want patients doing any heavy lifting or exercising. Now that does not mean that you're home bedridden for 6 weeks, but it just means that it gives patients a certain expectation of when will I feel kind of normal and when can I go back to exercising. And so I tell patients for recovery time, 2 weeks off from work, minimum really for a tummy tuck, and 3 weeks is better. So for breast augmentation by itself, you can go back to work after a long weekend, but you can't lift for 6 weeks. After surgery, I don't want patients to fly for at least 2 weeks. And that comes from the American Society of Plastic Surgeons. We want to decrease flying because of risk for blood clots or wound healing due to changes in the altitude. In terms of recovery, no submerging the incisions for 6 weeks. So that means you can shower after a couple of days or a week, but you can't take a bath and you can't go swimming for about 6 weeks after surgery. So the best time for a mommy makeover is when it fits into your lifestyle with your family and your responsibilities. Obviously, after having a child, I would not recommend any type of mommy makeover for at least 6 months. It's going to take at least 6 months for your body to retract or change after a pregnancy. Right afterwards, your uterus can be still enlarged, and it takes 6 weeks for a uterus to shrink down. If you're producing milk or nursing, we want you to wait at least 3 months really after breastfeeding before having surgery to allow your milk to dry up. So maybe it's easier when your baby's 6 months old and can be cared for by father or partner or a mother or another caregiver. Because again, 6 weeks, no lifting, and that includes your child. So I will always ask patients about, who's going to help take care of the babies, who's going to help take care of you, so that they have a really realistic expectation of what's going to happen. And there's ways around it, there's ways to adjust, and we kind of recruit a village of people for patients afterwards so that they can have the opportunity to take the time that they need to heal. Because part of a mommy makeover is that women sacrifice their body for their children, and this is their opportunity to really give themselves some self-care and self-love and put themselves first for a change. It's only for 6 weeks and we go back to being caregivers for everybody in the world, but really I want patients to take the time that they need for their body to really heal.